many connections, and I'm very pleased to welcome all of you. My name is Francesco ZAMBON, and I'm the coordinator of the Regions for Health Network, and we are here opening this virtual room from the WHO Venice office, which is the Office for Investments for Health and Development. I hope that you are familiar with this series of webinars that jointly with the Bonn office on environment and health and with our regional office in Copenhagen and also HQ, we are organizing for our network members, and this is actually a webinar which is also open to other external partners. You know that this series of webinars started in April with the first webinar, which was focusing on the Ostrava Declaration and its follow-up. And last time in May, we had a very interesting webinar on HEAT, which is the tool for the economic benefits of walking and cycling. And today we are going to focus on AirQ+, which is the tool for assessing the health impact of air pollution, which is, of course, a very important topic and problem nowadays. As you know, there will be also 3 more webinars in the future. These will be, the dates will be announced later on, and they will take place after the summer. But before going to the very topic of today, which is air pollution, let me remind us all that today is the World Environment Day. So there couldn't be a better date to have this webinar today. The World Environment Day, and I invite all of you to search online for relevant material on this, was born in 1974. It was set up by the United Nations General Assembly, so it's a very important day which is happening in the world. And today, as you might have heard, I'm sure that you have seen headings in newspapers, magazines. The theme of this year is plastic, and the theme of the campaign and the name of the campaign is Beat Plastic Pollution. I just want to read what the Secretary General for United Nations said on this very day, and he said, on the world every day, the message is simple: reject single-use plastic, refuse what you cannot reuse. Together, we can chart a path to a cleaner, greener world. I think that the most important message here is that the call is to us. So it's not only to big enterprises, producers of plastic or whatever, but it's about a call that is made to us to change our lifestyles. You can also see that the figures about plastic pollution figures are alarming. Like I will only give one. There are 300 million tons of plastic waste, which is the equivalent to the weight of the entire human population, which is quite astonishing. And also the 60% of plastic which was ever produced has ended up in a landfill or natural environment. So that's why you have this picture here on the screen now, just to remind us all that something is possible to do about it, and it's not a call only for big stakeholders, but it's a call for every one of us. And now we go to the topic of today, which is air pollution. That's, of course, a very important topic. It's responsible for 7 million deaths in the world and 500,000 deaths in the WHO European region only. It accounts for 5.4% of all deaths in the world. And there is also an important inequity dimension, as the mortality rates directly attributable to air pollution are double in low and middle income countries compared to those in high income countries. Air pollution, as we know, does not have any border, so that's why it's important to have a wide community addressing this topic. WHO has developed a very useful tool, very practical, easy, I hope, to use, as we will see in a minute. And I will leave now the floor to Pierpaolo Mudu, who is Technical Officer on Environment and Health, for his first presentation on the tool. And then there will also be a live demonstration, as it was done for heat, so that you can see how you can use the tool. And of course, we are available for any further information which is needed. Again, we don't expect that you become a master in using these tools, but definitely these webinars want to make you informed about their existence and the fact that they can have very practical implications for your work. Some housekeeping information before we go ahead. This webinar, as all the others, is recorded. You are muted so that the background noise is diminished. The chat is visible to everyone, so be careful with what you write. And all questions, that I hope will be many, are channeled through the chat. So please write down your questions as you have them, and then I will direct them to Pierpaolo through the chat. Okay, so now I would like to give the floor to Pierpaolo, who is speaking today from Geneva. Pierpaolo, are you there? Pierpaolo?
Can you hear me?
Yes, we can hear you. Yes, now we can also see you. Thank you very much.
Okay, and can you see my screen?
Yes, we can.
So I can start the presentation?
Yes, you can start. Please go ahead.
Okay, if there is any problem for the visualization of slides, just tell me, okay?
Yes, we can see your presentation and we can hear you well. So
okay,
you can go
good.
ahead.
Okay. Well, thank you very much for the introduction, and it's a pleasure to be here with you virtually. And I'm not in Geneva, actually I'm in Bonn now, and it's sunny also here. And what I'm going to do is a very short presentation of our work that has been going on for more than 20 years on facilitating the calculation of the health impacts of air pollution. I'm Pierpaolo Mudu. I am a statistician, and I've been working on air pollution issues for 17 years. And the new tool that I'm going to present you was designed in 2014. So you will see how we developed our, I would say, software to make people understanding and to make people calculating the health impacts of air pollution. My presentation is divided basically in 4 parts. So there's in 2 parts. There are a group of slides, and then there will be a demonstration of AirQ+. The slides will cover 4 different aspects. What is AirQ+? How it was received, AirQ+ when it was launched in 2016. The new version that we have put online 2 weeks ago, that is the 1.2 version, and then future plans for our software. And then I will give you a demonstration of some simple calculation that you can do with AirQ+. So the first thing that I have to tell you is the fact that this is a project that has been funded by the German government partially. And thanks to the German funds of the BMU, we started designing a new version of the software that we have been using for 15 years that has been online, and it was called AirQ. And in 2014, we realized that our old software could not be used in the new platforms that they were existing. Like the new Windows 7, the new Windows and Macintosh machines. And for this reason, we decided to update the software. But update the software has meant also a lot of different improvements. and I'll show you what you can do very soon. The main purpose of the software is obviously to make calculations for the health impacts of air pollution in a simple way, in a way that can be understood literally in 1 hour, 2 hours by people that have very limited skills in air pollution, I would say. So they're even not for experts. And that's why this tool is also used for educational purposes and for training activities. And for this reason, the software has has more freedom than other software that are available also on the web. And before launching the new software, we have been reviewing and discussing the existing tools in expert meetings in Bonn. And I have to say that at the end, what we have designed is something between the simple thing that you can do in an Excel worksheet and a very sophisticated modeling that you can do, for example, with GIS. So the idea, the most important thing in designing the software was to have something that is user-friendly. And the user-friendliness came after a long series of discussions with experts that took more than a year and a half. Some of the experts, most of the experts are acknowledged for their work, obviously, in the software. And all the people that have contributed to the development of the software are acknowledged for that. So this means that the software is not a one-man idea. It's a teamwork that has been going on for many years. And the main purpose for people that are interested in the calculation is to have estimates of the air pollution impacts on health, and also allow some calculation for the burden of air pollution. This software, as it is user-friendly and can be learned in 2 hours, 3 hours, can support decision-making and it is used in communication. It is used also in debate in different countries, in different cities. So I was anticipating that AirQ Plus is designed to make a couple of different calculations. One is related to the idea of building scenarios. So you can, having your values of air pollution, of concentrations, you can make a kind of estimate of how much of your air pollution is responsible for mortality against a counterfactual, against a cutoff value that can be, for example, the air quality guidelines, a value from the air quality guidelines. Or you can calculate the burden of disease that's due to air pollution, and it is usually done with IER curves, but this is a global kind of calculation. And AirQ Plus was designed to make, in particular, the calculation of impacts. And furthermore, AirQ Plus is based on the European revision of the relative risk that was done and published in 2013. It's called the ERAPIE project. And there is a link to the ERAPIE project when you open the software. The target users, as I was mentioning before, is designed for public health or environmental specialists. But we also don't want to limit ourselves to just public health or environmental specialists. And the important thing is that to have some basic, obviously, knowledge of mathematics for calculation of percentage, for calculation of rates, understanding literally the basic for mathematics. I have just mentioned the fact that we have the calculation of burden, the calculation of impacts. And the other thing that is quite interesting is that obviously we have a calculation for long-term impacts of air pollution because they are the main impacts of air pollution. But the software also allows calculation for short-term impacts that can be useful for some descriptive analysis. But for advanced user, and here you need some specialists, you can make calculation for the years of life lost due to air pollution exposure. And this part is quite innovative. It was already present in the AirQ version that has been available online for 12 years. And it is under improvement, also this part for a graphical output and for the data inputs. AirQ Plus is downloadable online. It's free. So you can just enter AirQ Plus on Google, and I just switch on Mozilla Firefox. Do you see Mozilla Firefox here? Hello, Francesco. Can you see my?
Yeah, we can see your screen now.
Okay, I just put.
Yes, I can see that you are googling.
Okay, so I'm googling AirQ Plus.
Yes, we can see that.
Okay, the first entry is exactly the web page of AirQ Plus. So the first entry after you Google AirQ Plus is the web page that we have designed for the software. And here you can download the most recent version that, as I told you, was just released 2 weeks ago. Here you can download the software for Windows or for Linux, and that this is also compatible with Macintosh. There are also some materials that you can see. I mean, you should download. It's not a big thing. It's just key features. And then there's an examples of calculations that we have put for people to understand what they can do. And then after you have used the software, we suggest to have you filling a survey that we have here in the web page. You don't need to install the software. This is quite important thing. It is zipped. So you download it, you unzip it, and you can use it. As the software is written in Java language, it's platform free. You can run it also in your USB stick, and this is what I will do now in a minute. So you don't need to make any install. So you don't need to set up. The software is already running. You can launch it quite easily. Just to give you an idea, when we redesigned the software, we didn't expect, at the beginning, the idea was just to have AirQ in a way that could be used in the new Windows and Macintosh platforms. But then we discovered that there was a huge interest for the software, and we got in 2 years 14,000 web page visits. And this was very unexpected. And the fact that the software has been downloaded also heavily in the 2 years, in the first year particularly, has put us in a new situation where we have decided to go on with this project for longer than we have done in the past for the previous RQ, where we stopped any development in 2006. And the other thing is that even if this is a tool that was developed by Euro, so it was developed by the Environment and Health Center in Bonn, this tool was soon adopted all over the world. And from the web statistics, we discovered that it is used in the Middle East, it is used in North America, and heavily also in Europe. And this is just an idea of the top 10 countries of people that are visiting our AirQ Plus web page. I'm showing you these statistics because we have done something that we have not done in the past, in the sense that we are monitoring the use of the software quite in detail. And this is giving us a lot of feedback, a lot of comments, and a lot of suggestions to improve the software, understanding how the users are, where are the users, how the users are literally seeing the software, if they are working at urban level or regional level or national level. In the past, the software that we had, AirQ, was designed to have country level applications, but then we realized along the years that people are using this software at a regional or urban level. So this is quite important, this monitoring exercise that we are doing, because they're giving us the idea of how also capacity training building, how communication is working. If, for example, we have a capacity building in a country, we can see how then there is an increase of the use of the software in the country. I mean, this is not trivial to do it, and we do not do, I should say, for all our products, but in this case, I think we are trying to have the situation literally under strict control. And I just give you now a few slides before moving to the software as running the software, just to show you that this is the welcome screen in English, and there's a welcome screen in Russian. The new version that we have the middle of May, it's bilingual. It's both English and Russian. And we have already finalized, and it's under test, a French version. We hope by the end of the year to have the French version also available. And this is just for you later when you will have the slides, an idea of an example of analysis, but we will run an example of analysis together. This is also another example of the output that you have when you use AirQ+. And one thing that is very, very important is the fact that we suggest the use of relative risk that are related to the IRAPIE project that was finalized in 2013, and the report is available obviously online. So there are some preloaded data sets that users that have no clue about the order of magnitude of relative risk, they can play at the beginning. I mean, they can use preloaded data. And these data are relative risks for selected pollutant, and I will show you when we start running the software. Then we have some conversion factors between PM2.5 and PM10, because many times in many countries or cities we don't have PM2.5 measurements, but we have PM10 measurements. So we can then, as we use PM2.5 as our indicator for making calculation about the estimates of health effects, for example on mortality, it is good to convert your PM10 data in PM2.5. And then we have an experimental part. I mean, there are some experimental parts that are within the software. I say experimental because they are under test, and we have put these because we think that the future is on developing these modules and these parts better than it was done in the past. Where, for example, in solid fuel, the effects of household fuel, there are no other software that are doing this calculation, and even if we know that we are providing very, very rough estimates, we want to put a module on household fuel impacts, and we are waiting, we are collecting suggestions and comments, because this module, I think, in the future will be quite important. Having said that, if you have a preloaded data set that you can use for your calculations, but at the same time you don't have preloaded data for the air pollution levels, because the user has to provide the air pollution levels of the concentration where they are measuring impacts. You need to have the population exposed, data, and you need to have some baseline rates for health. But the users can change the default values, and they can use the software, I would say, almost freely. If they are expert users, they can change also relative risks, and they can use their conversion factors related to the place where they are living. I think I can move to a demonstration of the software if there are no questions from the audience. Francesco, any questions now?
I think that no, not at this point. I think that you can go through the demonstration, and I'm sure that the questions will come later. Please remember, when you think now of questions to make, to send them through the chat to everyone so that we can see them. But now let's see how the tool works in practice. Okay, I switched to my USB pen drive. So you see it's a removable disk. Can you see the screen, Francesco? Yes, we can. Okay, and I have unzipped AirQ Plus, the 1.2 version, the one that you can download it. So once you download the version, basically you have the possibility to launch AirQ Plus through an executable file. I'm launching now the new version that is both English and Russian. By default, the software starts with the English version. And if you can, okay, you can go to the Russian version by clicking here, and you go Russian. But you have then to restart the computer in order to have the Russian version starting. This is first thing that I want to say. This is the welcome screen. So when you start working on AirQ Plus, I suggest you to click what is AirQ Plus. Here you have an idea of what is the software, and it's a summary of what I have told you, but it's not also a summary. There are some more information. For example, which situations can AirQ Plus handle? We have put here in the what is AirQ Plus something that comes quite often in this is a kind of frequently asked questions, if we can use this software for acute events, and obviously it's not. This is a software that should be considered with all the epidemiological evidence that is related to short-term and long-term effects. And to be even more precise, there's a table where there's health points that are suggested to consider for calculation. Here you have the ambient air pollution, long-term and short-term effects. Household air pollution is here on the right side, but this table is important to give you an idea of what are also the relative risks that are provided by the software. So PM2.5 mortality, all natural causes, and then you have mortality for some specific causes of death, and then you have data for hospitalization and for restricted activity days. This is just to give the user an idea Pierpaolo, this is just to say that we are seeing now the welcome screen. Are you still there, or you are describing a different function? Because this is what we can see. Welcome to AirQ Plus. Is that correct?
No, I was showing you a table.
No, we cannot see the table. Let's see if we can.
Okay, let's do not waste time on on this, but if you click on open on your software, on your AirQ Plus, there will pop up a table where there are the health endpoints that are suggested, and they are part of the work that was done during the Eurapia project. This is quite important for the user for the first time to understand how to work with AirQ Plus. The other point that we have put just on the welcome screen is the getting started. And the getting started gives a user for the first time what kind of data he or she has to collect and what kind of data he or she has to input in the software. And the data that have to be considered in calculations for the estimates over pollution are not many. Each of these data anyway has a lot of complexity in the sense of discussions, of measurements, and they are not trivial at all. But here there's a summary in the bullet points of the data that you need to input when you want to do some calculation. So you need air quality data, you need the data for the population, you need health data, you need a relative risk, and you need a cutoff value for consideration that can be the air quality guidelines.
Pierpaolo, this is Andrea, sorry. Could you share your screen?
I'm sharing the screen. Can you see the screen?
Now we can see the screen. We can see getting started, which data must the user provide.
Okay, sorry, I don't know what happened. As I was saying before, this is just a summary of the data that a user has to provide to run one analysis for in AirQ Plus. This is usually for PM, and we have also introduced nitrogen dioxide and black carbon. Black carbon is also part of the kind of experimental way of working. We want to see how people are using black carbon. That can be quite important in highly traffic and polluted streets and highways. Ozone is a different case, and there are some comments also on ozone. So this is the getting started part, and I think in the welcome screen I will just indicate the fact that there is a glossary that people can click, and there is an explanation of the main words, all the keywords that are needed to understand the functioning of the AirQ Plus. And the glossary is not a huge document, but whenever there are problems in doing calculation or understanding what are you doing, you can refer yourself to the glossary. We kept the glossary at the minimum. This is part of the philosophy of AirQ Plus. We did not want to build a huge monster with thousands of links, with thousands of documents, and most of the discussions are basically on what is the basic that people need for running the calculation for the impacts of air pollution. It is possible to do more sophisticated calculations with other software that are available. I'm explicit on this. There is the US EPA that has created a software called BandMap. They run also with the GIS facilities, and it's much, much more sophisticated than AirQ Plus. But on average, our results are the same than the results that are obtained by people running BandMap. I now would go for a quick analysis of some fake numbers on AirQ Plus, and the first thing I want to show you is how to create an analysis. So there is two possibilities. You see there is a plus here, create new analysis, and it's the same here. So we can create a new analysis, and by creating a new analysis, you have the choice to go for or ambient or household air pollution. but usually you work with ambient air pollution, we go for long-term effects, and you have to specify your location. Let's call it city. I can go now for city 1. Our pollutant is PM2.5, and we want to do an impact evaluation. I click OK, and if you see now the screen, this is the screen that gives you the first check of the data that you need to have to start an analysis. It's very simple. I told you we need air pollution data. Imagine that in our city we have for PM2.5 a yearly concentration of 25. So it's in Europe it's a medium-high concentration that we find in some cities. So this is a yearly average for long-term effects that we need to consider. Let's go very easily on a population of 1 million. And our year, let's consider that we have the data for 2017. If you see the green fields are the fields that we need to provide some input. The other fields are unnecessary. But we have put for the record, for the people that are using the software, the possibility, for example, to insert comments on the source of measurement of air pollution, on the number of stations that are used and type of stations. This is quite important when you run several analyses. So we are now in a city of 1 million inhabitants. We have a level of yearly air pollution that is 25. These are the yearly data for 2017. They were calculated. Let's assume that we had, for example, 3 monitoring stations that gave us the data, not in industrial areas or neither in traffic, but this is reflecting the exposure of the population that is living in this city. So we can create a new impact evaluation. We just click on Create New Impact Evaluation. Let's call it mortality, CD1 mortality. CD1 mortality, so we remember what we are doing. Long term of PM2.5. The second thing that we have to do now is to decide our health endpoint, and we decide to go for mortality or natural causes for adults age 30 and more. So this means that we have input 1 million people, but or we have input only the adults that are 30 and plus, so all the adults, or we have to consider the fact that in reality the adults out in that population are, for example, the 80%. So the population at risk go from 1 million to 800,000. And then we need to have some data on the incidence per 100,000 per year. And we can put here, just to play with some numbers, 700 per 100,000. That is a value that we can find in our European cities. The methodology that we use here for risk is a log linear approach for the calculation of the relative risk. The relative risk by default here are the relative risks that you find from ERAPIA, that is the meta-analysis that was done by Gerhard Oeck a few years ago. And this 1.62 means that for every 10 microgram of PM2.5 increase, we have a 6% additional mortality in the adult population. This is the central value. We have also the confidence interval for the lower and upper level. And the other number that I was mentioning before that is important is the cutoff value. So we want to fix a value under which there is no risk we know that the air pollution, unfortunately, affects us also a very low level of concentration of PM. But WHO, in the air quality guidelines in 2000, in the update that was published in 2006, we have put 10 as a value that should be reached in order to improve the public health of population. The air quality guidelines are now under revision. Could be that this value of 10 would be revised. So we are basically going with a difference of 15 between our yearly level of air pollution of 25 and the level that we consider as safe for public health, that is taken by the air quality guidelines. This way, with just clicking on calculate, we can attribute to this level of air pollution with this population, with exposure of 800,000 people, we can have an estimated number of 483 deaths that are attributable to air pollution. We have also the estimated attributable proportion, that is 8.6%, and the number of cases per 100,000, that is 60. We have some detailed results that we can check if we are interested in understanding the calculation. They are explained here, all the basic steps to make the calculations. And also in the detailed results, we have an idea of the shape of the relative risk, and we see that we are using a kind of linear function, so we must be very aware of the fact that after a value of 35 or 40, we have not to use this kind of function. I will stop here in a second. The only thing I will show you is the fact that we can change our cutoff value. For example, the European environmental agencies in their annual air pollution report are using a value of 0. So if we use a value of 0, we can recalculate the attributable proportion, and you see that it's 782. So you can play with the data. You can change also the relative risk if needed, but this is what we have done with this value. Is I think a real calculation that you can easily repeat in your place, but you have to take into account all the hypotheses, all the assumptions that are used in the calculation. Francesco, I think I can stop here. If there,
yes.
If you have questions.
Thank you very much. I'm now asking everyone to pose their questions through the chat. I have also some questions myself. I think that the presentation was very clear, and clearly there is the need to have some data which comes from the environment agencies, which are usually available at regional and city level, so this is not a big of a problem. I was really impressed by seeing that the number of visits of the AirQ Plus was 14,000. That's really amazing, and I wonder also whether you know how this tool has supported policy making, whether you have any concrete example of that. One more question specific on the tool is, how do you make an assessment of the population at risk? In this example, you said 80% out of the entire population. How do we establish that? Okay.
I start with the last question, that the population at risk comes from the epidemiological studies that you have to use to build the long-term exposure, the long-term effects of air pollution. Long-term effects are based on cohort studies, and where they follow hundreds of thousands of people that are usually adults. So in our population that has 1 million of people, we know that our relative risks are related to the to the adult population. And we have made a rough estimation that out of 1 million, we have 800,000. So 80% of that population is the residents, adults in the city. The calculation of exposure is quite important and is very relevant. It's not an easy task. And I understand that you have to think twice before putting the number of exposed people, because you have to consider that if you are in a city, that if you are in a metropolitan area, if you have a metropolitan area, how reliable are the monitoring stations, and how far you can extend the value that you have been calculating as a mean to a large area. I mean, these are literally the details where you have, once you start doing an impact assessment, that you have to take care. The other point that you were mentioning about we were very surprised about the 14,000 web visits. It was a big surprise. And this has, it's a big support that for the project, and we have long-term plans for the project.
That's it means that there is a very big demand for that, of course.
And I want to answer the other question
here, and I would like to ask you to keep. Yes.
I want to answer the other question that I think is relevant. This software.
Yes. Can you please read also the question so that everyone, because I'm not sure that everyone can read the chat. So if you can go question by reading it also to make it clear for everyone.
Okay, sorry, I couldn't read the chat. So I'm trying to see if I can find it somewhere. But
I will then ask you the questions one by one. We have a question from.
Can do it because I cannot see the chat, Francesco. But I want to answer your question that it was about the use of the software in policy making. Yes, the software has been the first version of the software, AirQ. We were unable to monitor literally everything on the web for 12 years, but we could download, and we had made an extensive research about the use of AirQ along 12 years, and we discovered the reporting and the use of AirQ all over Europe, and there are literally all kinds of cases in a small province in Italy, in big countries. So the software has been used to improve public health. And I can give you another case. At the current French version is under test officially by the French government, by the public Santé Publique in Paris, in France, with 40 different cities about improving air quality. So the examples are a lot. If you are interested in some specific example, let me know.
Okay, thank you. I have now a number of questions, and I'm asking you to keep the answer very short, otherwise we will run out of time. The first one is, what formats for air quality data are you accepting as input? Like, does the tool accept aggregated data as gridded data and or at point locations? Does the tool accept time series? This is one set of questions, if you can reply to that.
Okay, in this version, we can work with time series, and then you use them for short-term effects. And in the next version that we want to release in October, there will be the possibility to run in parallel also grid values, in the sense that you need to have, I don't know, 50 different neighborhoods or regions or provinces or areas that you have in a country, and you can run them together. At the moment, you have to run them separately, and but we discovered that people want to run many areas at the same time.
Thank you. Another question is, how can I put the value of mean concentration 25 equal to 25, for instance?
Well, you have two ways. One is that you start a new analysis, there is the input of concentration data, and you can input directly the 25. or you can calculate that by inputting the data and answer also, forget to answer to the previous version, that you need text ASCII data, and you can, and the software reads automatically hourly, daily, or weekly or monthly data in if they're in ASCII format, comma delimited format.
Okay, thank you. Another question, and in the meantime, I ask people to send other questions through the chat to everyone. Another question is, I don't understand if I need to find the incidence per 100,000 data locally, or is an estimate provided by the tool?
Well, this is a good question. You have to find your local estimate. We are working now, we realize that this, for people that have not been working on this kind of impacts, is a difficult value to be found, but usually the mortality rate, the incidence of mortality in places, at county level, can be easily retrieved. It's much more difficult at the city level, and then at that point you have to calculate yourself. In the new version that we are testing, and there is the possibility for users that do not have the incidence rate to make a rough calculation, but at least they need to know the number of deaths. One part of the work that we will do in the next month is to provide probably a table with examples of incidents around the world in many countries, just to give people an idea of the range of for example, of mortality. So there will be examples from different countries, but it will be more educational, I think, that taking the data from this short document will be basically a table, I guess.
Thank you. Please, participants, do send other questions as we still have some minutes. Another question for you, Pierpaolo, is can we apply these methods to small populations, like a village of 10,000 people, making clear, of course, that uncertainties may increase?
Yes, you can. You can apply to. There are examples of applications of villages of 10,000 people. You must be, I think, aware of the levels of air pollution and the exposure of how many people are exposed to the levels of air pollution. You can do it. Obviously, the numbers will be low. It depends also for the levels of air pollution that you have, but the attributable number of deaths can be just in the order of 5, 7 persons, I don't know.
Okay, thank you. And you said before that this is for long-term consequences and not for acute events. Is there a plan also to include among the future features of this AirQ Plus also acute events, which is, I guess, maybe a recurring question for you?
Well, this is it's a frequently asked question. Is the most we have these all every week. The issue is the following: that the impacts of air pollution, the serious impacts of air pollution, are long-term impacts. I can run if you run a short-term impact of air pollution, you see the relative risk. You will see that you have a 10% impact of air pollution at the short-term level. Acute episodes are much more difficult to be analyzed because they are related usually, I don't know, to an industrial explosion or a day in which there was a heavy traffic and there was a heavy congestion. I mean, these are much more difficult to be assessed. At the moment, I don't think we can have a software that can make any calculation on these, because the calculation should be on the number of people that are hospitalized on like 0, like 1, like a week. So this is something that we are not moving soon, but we can discuss this in the next future.
Thank you. Another question, for long-term impacts and thinking of a change in AirQ from a policy or project, what can one assume to be the time lag between change in exposure and the realization of the health impact?
Well, this is related to the fact that when you do a calculation of the impact of air pollution, you have to consider that you are relying on epidemiological studies that were based on cohorts. So group of population that were followed for 10, 20, 30 years. So what we know is that the lag, usually 10, 15 years. Also in the first cohort that were followed the American Cancer Society, I'm not sure now, I remember, I think after already 8 years, the relative risk were almost stable on the 6%. I have to check this, I'm just thinking loudly, but in any case, you have to consider that there will be effects on in 10 years, in 15 years. What you do, is based on the levels of air pollution that you have had, for example, on average in the last 3 years, 5 years, you say, okay, based on these levels, the premature mortality that can be attributed to air pollution is equal to a certain number. This is the main, output that you generate.
And another question, how do you control the spatial level of aggregations, national, region, city? Does it depend on the way how the air quality data is organized as input? How do you control the spatial level of aggregations in the results?
Well, if you want to go at that level of analysis, well, probably you have to use band map. You have to use some more sophisticated models that are based on GIS. Again, if you go for more sophisticated models, you will end up in problems that you are mentioning about the spatial aggregation. But in reality, again, long-term studies are based on cohorts that are followed in cities. So the important thing is that you have reliable data for average measures in a city or in a region. The spatial level of aggregation obviously can change your results, but then again, it means that you're going for a more sophisticated analysis in which, for example, you can make a lot of different measures of exposures, and that can give you, I think, and that's quite important, socioeconomic discrepancies in the exposure. You can have low-income people more exposed to levels of air pollution, and you can make some assumptions then on the health impacts of air pollution, but usually, you cannot go to impacts, but you can tell that, okay, the level of exposure for certain areas, for certain groups are higher than others. And that's already, I think, from a public health perspective, a result.
Thank you. And two more questions, which with a short answer because time is up. What does short-term mean and also long-term regarding mortality? Weeks, months, years?
Well, as I was mentioning before, and I repeat again, long-term, it means that you are using relative risks that were based on cohort studies. While short-term, it means that the calculations that you're doing are based on time series. And this is a very different approach. And short-term usually is less than a year or 1 year, where you have a time series and you have daily data, for example, and you can input that data in the software and you can make some calculation for the short-term impacts. But please take into account the fact that all the short-term impacts are included in long-term impacts. So it does usually, if you have data, you have to run a long-term impact analysis. Only if you have just short-term daily data, you can use them, but they cannot replace long-term impacts.
Thank you. Another very important question, which is linked to something that you said earlier. What about translations to other languages than English and Russian? Could we have it in the future, any official permissions to be able to use it, I guess to translate it also and to use it? Any other plans, given the demand on this tool for other languages?
Yes, there will be, now we are trying to consolidate the version by the end of the year to have a new version, and there will be trilingual, there will be also in French. And there already we have an agreement to have it in Spanish, but nothing prevents us next year to go for other languages. No problem for that.
Okay, we will let you know whether there is any one of the participants who would like to take the initiative on that. And one last question, why the choice of a standalone tool rather than a web-based tool?
Oh, well, when we redesigned the software, we understood that most of our users are global users, and that there's a lot of users in Asia and a lot of users in Africa. And most of these people do not have a good web connection. That's why we decided on the first instance to have a standalone software. But it's true, we have plans to check in a year or two to have a web tool.
Thank you very much, Pierpaolo. I think that the time is up, and also I think that the questions part was very interesting and very practical. I hope that you all enjoyed it. Thank you very much for your expertise, and no doubt there will be follow-up with you for people coming back to you, asking questions, more specific questions about that. I would like to remind everyone that we have 3 more webinars which will be run after the summer, and the dates will be announced shortly. One will be on the health impact assessment, so another very important topic, and we hear about that every day. Another one, again important, on climate change and health adaptation cost tool, and another webinar on urban green and blue spaces. So I will send an email with the dates soon. I would like also to remind everyone that this webinar will be posted shortly on the RHN YouTube channel. So for those of you who want to watch again some parts of it, or for forwarding it to colleagues, you can do that. I will send an email with a link today or the day after tomorrow, or tomorrow. I would like to thank once again Pierpaolo Mudu for this fantastic presentation. It was really enjoyable and very useful and very practical, so thank you very much for that.
Thank you.
And of course also a big thank to Dorota Jarozinska, who is the program manager for this specific area in the Bonn office, and to our people who made it possible, Andrea Bertola for the IT support. I think that we had 60 connections, which is 60, so quite impressive number of connections today from all over Europe. And I would like to thank you very much for watching this webinar, and we will be in touch shortly. Thank you very much. Bye-bye.
Thank you.